Yes, today is June.
Hi, how are you doing, sweetheart?
Good, how are you, honey?
Good. 1 6, thank you. Okay.
Oh, I was wondering, I forgot to tell you, I've been diagnosed with hyperkalemia, low potassium.
Okay, that's checked on here, so we'll talk
Oh,
about
okay,
it.
okay.
Okay.
And tachycardia.
You do not have tachycardia today.
No. I have it. It's,
Okay.
yeah. It's,
So your heart rate here is good.
right.
Next, your, the one for autoimmune is negative.
Right, I have, I showed you, I have CRPS too.
Mm-hmm.
I'm never gonna do that EMG, whatever it's called.
Okay.
Oh, yeah.
They can be painful, yeah.
Yes.
Your B12 is good, your thyroid is good, your vitamin D as in dog is good. Your blood sugar is excellent,
It goes, yeah,
up and down. It's
yeah.
excellent. Your liver and kidney enzymes are excellent, your cholesterol is excellent. You have a little bit of protein in your urine.
Yeah.
It doesn't mean anything, it needs to be followed again in 4 months.
I was wondering, for a bladder cancer check.
That's why we do this, to make sure there's no blood in the urine. You don't have blood in the urine.
No, but other places have put blood in there and it comes and goes.
I have to have 2 of them, otherwise the insurance won't pay for it. The doctor won't see you. I have to have 2 with blood in the urine.
Oh, can I show
We
you?
all get blood in the urine, we all do, okay? That is common. Yours does not, right now, there's no blood in the urine.
Right,
So,
but if I showed you proof that I have a history of blood in urine,
If you feel better, I'll send you to a urologist, they can decide if they wanna do it or not. But don't put in here, you make sure mine says that currently no blood in the urine.
Yeah, but but I can show them like a history of it, if that's okay. Cause I know it comes and goes, it's weird.
Yeah, when it comes and goes, it's not cancer, cancer never comes and goes. We
Oh.
all have blood in our urine coming and going.
Okay, well, the adrenal gland, you're gonna get me a surgeon for that? Because
For
that,
which gland?
for the adrenal gland nodule, the tumor that's grown since last year.
Same urologist,
What is it called?
same urologist,
Oh, okay.
same doctor.
So not a endocrine surgeon?
Technically, it's not really an endocrine surgeon, because we don't have an endocrine surgeon. Is it on the kidney,
Yes, on top of the kidney.
or is it on the adrenal gland?
It's on top of the kidney. It sits
That
on top of the
goes-
kidneys.
That goes to the urologist.
Oh,
They're
I
the
see.
only people that does any surgery.
Okay.
Oncologists don't do it, endocrinologists. If
Sorry,
it is
I-
on the kidney, if it's on the kidney, it's a urologist.
Oh, I see.
Same people that check the blood.
Because I've been on blood pressure for a year and I can't take it because it drops like to
So
80.
don't take it.
Yeah, I don't. That's why it's, that's why they think it's that causing the whole like
It can.
weak and, just things, and I just know my body, it's that, you know what I mean? And plus it's grown since less than a year. Now it's 1.712.
When was it last imaged?
When I went to New York. And I will bring that in, you can see under it when it grows.
I need you to bring that to the urologist.
Okay. And what else, just real fast, the blood clot that you felt, I have a special gift. When you felt it, it went down, can you just look at it?
Good, that's a cyst, not a,
It was a blood clot. But it was red, throbby, my friends are RN, but
that's not, you can tell her it was a cyst, it wasn't a blood clot.
oh, the other doctor said it was blood clot.
That's a cyst. Did they do an ultrasound? If they did an ultrasound, then they would say it, otherwise.
He put blood clot, but verbally he told me no. It's, but on documentation, says, documentation, he said blood clot, and he was looking for it, but he didn't do anything to it. I'm like,
Blood clot, that's a cyst.
okay.
And
Well, it went away, the blood clot, it's
just
going
so
away.
that you know, I still feel the cyst, there's a
Yeah.
cyst there. And that will come and go, we're born with them, and sometimes they get inflamed and they're big, and that will come and go. But by the way, if it was a blood clot, they're not a problem, the ones in our legs are a problem.
Right.
These are annoying, they don't go to our lungs.
Right, he put blood clot, but he didn't, but verbally he's telling me, no, he didn't, even though he wrote it, like he took a piece out and studied it. Did you see Dr. Federo's notes?
Mm. No.
Yeah, I'm not target. It's not. I wouldn't believe him anyways. I'm not mad at him. He's had brain traumatic injury, bad liver, bad kidneys, bad spleen.
Okay.
If you look at my notes right after that, right after I saw him, because I went out of state too, because I didn't trust him. Everything's good. You know what I mean?
Right.
I don't know why he was. I know why, but I won't say. But it is what it is, and I just leave it behind. If that makes sense.
That makes
It's my
the most
past.
sense.
It's my past.
Makes the most sense.
Yes, leave it alone and just don't. And I tell them, you don't bug me, I don't bug you.
There you go. That's the way to roll, my dear.
Exactly.
What else do you have?
Okay, and potassium, high blood pressure, medications at work. Oh, this right
Your
here.
potassium this time is Weighgarten, right?
Yeah, it comes and goes. But I was wondering if I can get a little bit of pills for the potassium.
Yeah, but how would you know when to take them?
I feel very
The high
weak.
potassium is much worse to have a high potassium than a low potassium.
Oh, really? Okay, then I'll just keep doing it with
Much
peanut butter.
The high potassium can kill you.
Because I live in a van right now, and I like it because I love nature.
High potassium can kill you very easily.
Oh,
Not
really?
low potassium, high.
Why eat a lot of peanut butter and apples? That's
Good.
That has, since I've seen you, I kid you not, I feel much better, like stronger. If you would have saw me in New York,
And maybe bananas?
yes,
Okay.
bananas. Oh,
That's
yeah.
an every dose pack.
That's why I was. I'm really weary about medication.
Uh-huh.
So I know what does this do? Like what does this
It
give
decreases
for?
inflammation.
But
We use it for breathing.
but if I have high blood pressure, I shouldn't take it.
No, you can't take it with high blood pressure. We always give it to people with high blood pressure.
You sure? Because I studied and said that.
Yeah, no, I'm positive.
Okay, and that helped with the CRPS, too, which I showed you proof. I mean, I don't know if you read it or not. And I've done wrong with my neck. Nothing wrong with my neck.
I'm glad there's nothing wrong with you.
That's why they did that thing.
Did we do that steroid for breathing or for the neck?
What?
Why did we do this? What
Oh, you did this for
CRP?
CRPS too,
Okay,
for the inflammation.
for inflammation.
Yes. And this, I have gabapentin, but I don't take it because it doesn't work. It does not, what works is a Cymbalta.
Okay.
Yes, I know, I said 30, but you put 60, but that's okay. This is safe to take since my liver's good.
Yeah.
Okay, I just get worried about that. And,
You don't have to take that if there's no benefit with it.
this, I don't take nothing, yeah, I don't want, and then I take the Seroquel for sleep, but I haven't
Well,
taken it in a
that's
while.
Seroquel.
You see right here, it says for sleep.
You can't get addicted to painkillers.
Exactly.
That's stuff on it.
Yes, I've been taking this for a long time. Well, I haven't taken it like in weeks, or the Nesta.
Do I need to refill anything?
No, I have plenty. I'm just letting you know it's for
Yeah.
sleep.
Yeah, I see.
Yeah, and, but the Lunesta, since you said it was addicting, I didn't do it for 2 weeks, I kinda got scared now, I didn't bottle, I have a whole bottle at home, I just don't wanna do it.
If you can do, you're smart, that one's the worst one.
I'm like, I get
That
scared on
and
stuff.
Ambien, that and Ambien,
I told, Ambien doesn't work for me
Doesn't
either.
have to be addicted, it can be a dependent, your body gets physically dependent on that
Yes,
medication.
and this, for only 50 milligrams a night, I know this works very well for me. I
That's
sleep
stuff
7
on-
hours, for me,
Best stuff.
for sleep, you know what I mean?
Can't get addicted or dependent.
Exactly, and, cause I've gone without it, you know, you go on vacation, you forget pills, like, but the only thing is when I'm on vacation, I will take it because I like to be up all night anyways.
Oh my gosh, I'm
But-
so funny. Okay.
But if I wanna sleep, then of course I'll take it. And with the clozapam, that has helped with my anxiety a lot.
Good.
And I know it sounds weird, but my dystonia too, and it helps my ADHD. I know it sounds weird.
It actually doesn't sound weird, it actually makes sense.
Yeah, and I did twice the other day, but I usually do one, but I mean, it all
If you need
depends.
to do twice, it's okay, it's not like Xanax that we get very addicted to Xanax because it works.
I know, that's
Diazepam works over the course of several hours,
Mm-hmm.
if it is helpful.
That's true, because clozapam, what I did years ago, he said stays in your system longer.
Which makes it less addictive, it makes it just a better medication.
Right.
Big deep breath, bud. Your shirt is beautiful, so is your hair.
Oh, well, it's gotten thinner, but you know this shirt is since 2006.
It's beautiful.
I take care of this stuff. I like to take care of things. So, yeah, CRPS, I don't do pain management because I do it myself.
Okay,
I've done it
that's
for
good.
4 years by myself. I just like stretch it.
Can we take a copy of this so I have it?
Oh, you can have it. That's
Oh,
yours.
perfect.
And I'm never gonna do that test because it really made it worse, my CRPS
It
too.
hurts.
And if you put ice, I know it sounds weird, but if you put ice in my hands and ice,
Yeah.
it'll go like this.
The one for autoimmune is normal, it doesn't mean that it's definitely not rheumatology. I did a rheumatology referral, right?
What's that?
The autoimmune doctor for the ice.
Oh, no,
Didn't you
go
say
ahead,
that?
yeah. Don't freak out.
You said endocrine, GI, and hematology.
Because we have to do those first. Do me a favor. Endocrine, GI, hematology first, especially since the autoimmune labs came out normal. So if they're normal, they're unlikely to see you.
Yeah.
Okay, there's
But
no
CRPS, you can't really tell, you know what I mean? That's why they ruled out, lupus, they ruled out, I mean, so many things.
And the
They even
rheumatologist,
did AIDS test, I'm like, what? I was a virgin when I got
Rheumatologist?
married.
the rheumatologist is a lupus doctor, that's what they do.
Right, yeah, I don't mind if he wants, if I have
I have
it, that's
to do
fine.
the 3 first. I have to get to these 3 referrals
Oh,
first.
sure.
And then we'll do that.
Yeah, I know the one, I know, I come with a mess.
You're adorable, you have a nice personality.
Thank you.
Okay. Your things are good, we definitely need a copy of this thing.
Oh, yeah, you can have it, like you said. And, yeah, cause when I did shoulder surgery, and he did awesome. Bruce Lee's really great. I've had him for a long time. This was in a different state. And so when I was in Virginia, I never did any surgery, But where I was before, he did awesome. But I don't think, it was already hurting before he did that. It just made it worse, you know what I mean?
Yes.
But it was, like, the shoulder is awesome, so.
I love it, you did a good job with that.
Yeah, cause he did what did I
Have
say? Oh,
you done physical therapy for the CRPS?
yes, and they just did it for a little bit.
I think you should do it for 8 weeks.
You think so?
Yeah, try to get a different perspective on it.
Okay.
I understand, you
Yeah.
understand it, but
The only thing
what if
is,
somebody else can help us?
yeah, the only thing is like, it's so tight.
Your
It
shoes
feels
are
like,
adorable,
thank
yeah.
you. It's so tight, like how I tell people, it feels like it's mangled inside, cause it's cut. And it feels like you're forcing it to, it's just weird, that's all.
Oh, I'm doing it for all 4 extremities. I would like them to just very gently work with you and see if we can make any benefit. It's
Yeah.
not gonna make it go away.
Exactly.
Okay? But it may make a little bit of a benefit. If it is, it's non-invasive, it would be great.
Yeah, as long as they don't do no shots, and I don't want no, I know it sounds
I don't
weird, no
blame you.
medications.
I don't blame you.
And once in a while I do get those flare-ups, like, it feels like acid in your body, that's the only way I can describe it.
I'm still amazed, Angel, that you stopped using the Lunesta. I'm amazed.
Yeah, I just, when you said dick, and I didn't do it
is.
for
It's
2
good.
weeks, and then I was like, I still have a whole bottle, and I think it's a refill too, but I was like, nope. So I'll just stick with the
The
syrup.
Quinidine, yeah, the
The
syrup
one-
oil.
My
does a
sister takes
great
it for,
job.
we have insomnia really bad in our family,
It
really
does a
bad.
great job.
Yeah, and 50 works perfect for me. They hit
You
the
know, that's
100,
a
I
very
can cut
low
it in half.
dose. You know,
Yes.
50 is a very low dose. So Lunesta, how many milligrams was your?
It was 3. And she
And
did do her
just
best
so
because
that
I had severe insomnia.
No, I appreciate that, but just to let you know, Seroquel 200 milligrams is equal to Lunesta 3 milligrams. Just so that you know that, they're
Oh,
the
wow.
same amount of medication.
Oh, I see.
Same amount of medication, the numbers don't mean anything.
Right.
But if you can do it on 50, we
Oh,
go
I
on
do 50 perfect. And my husband, when he comes over, because we're separated, because like I said, and I'm in the van, and he goes, you already took your pill. I go, yep, because he sees me, which is good because, and like my doctor taught me years ago, because I used to fight it, she goes, just go with the flow with falling asleep. Don't fight it, because,
Yeah.
you know, then I freak out, like, you know what I'm saying? She was awesome. She was a long time ago, but she just go with the flow.
Good.
Yeah.
Good. I
Thank
still
you.
can't believe you stopped the Lunesta.
Yeah.
I mean, I
Yeah.
love it.
You see,
It's the best thing you could do.
Okay, thank you, honey,
Thank
for
you, sweetie.
everything. She's awesome.
This is their, I have to put it in through the portal, so it's not approved yet, so you can text this number to check on the status, but it's gonna be urology and physical therapy.
Oh, awesome.
There's no names of who you're going to yet, cause I have to, find out who the insurance wants to send you to. And I'll check on the GI, the endo, and the hematology that they put in last visit.
Yeah,
We'll see if that was
awesome.
done.
Yeah, so just, you said call this, honey?
Text
Text it.
that number in about a week or so to
Oh.
check on the status of the referrals.
So, but, I mean, the labs are pretty good. I
Yeah,
mean,
everything's great on the labs. If you want a copy, you can have these.
oh, yeah, please.
And you're all
That's
set. We
the
just
CDP.
repeat labs in 6 months, but
Yeah.
we're gonna work on the referrals for you so you can see the specialists.
I
She
really
wants you to see
appreciate it.
those specialists before you go to a
I think
rheumatologist.
the war is over now. Ah, peace now.
And yeah, your potassium's good.
Thank you, honey. Yeah, and it goes, my friend has a garden, so I just, like, eat a lot of greens and stuff.
Yeah.
Yeah.
Yeah, you
That's
just don't
what
wanna do the pills, cause if it goes too high, you can
True,
break
she
that.
said, yeah, my other nurse said, just do greens,
Mhm.
and vitamin C and all that.
Yeah.
Okay, thank you, honey.
Have a great
I
day.
don't need to make a point with them, right?
No, just check on the status of the
Right.
referrals.
Okay, thank you, honey.
Thank you.
Which one's out? Which one's out, honey? Oh, excuse me. Oh, this one's out.
Yes,
Okay.